Life Healthcare has
Heavy
been
sledding here, you know, you're giving me a hard time.
has been listed on the JSE since 2010.
And it has a bunch of hospitals locally. I think people are familiar with that. Then it's in India, but not that significantly, and in Poland, and now it's in the middle of trying to do a fairly sizable UK acquisition. We'll talk
Market
about.
cap, we're sitting at 35 billion rand, a PE here of 17.3, dividend yield almost 5%. Do you want to pull in on the transaction?
Well,
and
I
there's
mean,
the
it's
share price
interesting
graph.
because Life Healthcare used to be the one that didn't really have too many ambitions, particularly in the developed world. And everybody said, well, that's nice, you know, because India's got lots of upside.
Emerging market play, let's back
Poland
that.
is an emerging market, I don't know. Then boom, out of the blue, they say they want to buy Alliance Health, which is a UK company, for 10 billion rand. And it's mostly involved in support services, medical imaging and testing, and I don't know, like pathology, micro something or other. So machines and outsourced suppliers of imaging technologies too, like the NHS and other hospitals.
This one, have you had in any of your portfolios?
No, certainly we do have Life Healthcare. The net margins, I think they're the best in the sector currently. I think if you look in terms of also just their sales growth, slightly above their 5-year average sales growth. So I think they've done well. Also, like Paul is saying, they're starting now to try and also enter the developed markets, which is the UK. That will give them a good spread, and obviously with South Africa being the best, we hope they will be able to catch up with Netcare on the local scene.
Just get that share price graph back up there.
Yeah, so it's sort of wavered around. The 5-year chart will reflect, though, that it did very well, gets up into the mid-40s, and then has since sagged back a little bit around about the mid-30s.
But Joseph's point on this one having the best margins in the local
Yeah, that's
health
a reflection of
environment.
their solid, you know, operating assets down here in South Africa, where they've added extra beds to existing facilities. They've acquired and built a couple of others, and that's all been going fine. The UK acquisition, though, is interesting because at least they're doing it at the level of the rand pound now.
Not
Yes.
pre-Brexit.
Although, how would you know? Like, you know, the Mediclinic transaction wasn't well timed. The Netcare transaction looked very badly timed because of the global financial crisis. Then it got good again, then it got bad again.
Well,
It's
as
quite
you
tough.
say, this is a change in strategy for Life Healthcare, and maybe they're taking advantage of Brexit to pick up a reasonably priced asset.
And they want to be an international player, and good luck to them. I mean, there's no reason why you would want to be constrained and stuck in the South African market, which is somewhat mature. I don't know whether you agree with that or not, but in South Africa, most people who can afford a medical aid kind of have one. There's a little bit of infill, you know, people getting packages and
Well, you are
corporate
getting that ramp
employees.
up in emerging middle class, and I think one of the
Still some
items would
growth
obviously
there.
be healthcare. Let's call it, Joseph. Hot or not?
I'll call it HOT.
Hot. You own it, so that's makes sense. Hot or
Look,
not?
you know, it's got a rights issue now to fund this purchase, which is going to be approved at the AGM now, and then it could be that it's a little dilutive. I would
But
say,
it's picking up the asset potentially at the right price, Paul Theron.
yes, this is true, and that's on the basis that like, the UK is going to, yeah, okay.
Right,
Right, I'll
thank
go
you.
watch, why not?
Sure,
I mean, it's
that
close.
was really like